Friends, today I'm going to talk on a very important aspect of health, which we call post-COVID-19 antimicrobial drug resistance status. As we all know that antimicrobial drug resistance is one of the major issues globally, and none other country is left without spread of antimicrobial resistance across the globe. And to date, no antibiotic is left to treat patients caused by drug resistance, caused by bacteria having multi-drug resistant markers. The last resort of drug we called colistin after the imipenem and meropenem, that is the carbapenem group of drugs. Even we lost the effect of colistin in many cases. And I cannot say you the exact percent of colistin resistance globally, or especially in our country, in India, but I think it's a reasonably high percent resistance going against the colistin drug in the bacteria. So in this situation, what to do? And WHO has already announced that in 2050 more death will be taking place by antimicrobial resistance problem than any other disease, even in cancer. And they have given the data, almost 10 million people will die every year by 2050, whereas by cancer it is 8.5 million as per the WHO record. So in this situation, we have to be very careful about how to handle the antibiotics, especially our physicians and healthcare workers, those who are prescribing the medicine and antibiotics to our patients. Now, what happened post-COVID-19? The scenario has changed. This data was WHO has announced in 2014. But after COVID-19 scenario, the usage of the antibiotic is increased like anything. And hence, antibiotics are using, the percent of antibiotic use are much increased compared to earlier, because of the COVID-19 infection, patients having COVID-19, and the resistance increasing in the hospital setting because of this problem of overuse of antibiotics. Having COVID infection, which cannot be treated by antibiotics generally because it is a viral infection and it can be treated only antiviral drug or antiviral medicine. But these antibiotics are being given because to control the secondary infection during the intubation, during the ventilator. The patients are being kept on ventilators, are intubated in the hospital for a certain time due to COVID infection. So there's a chance of always nosocomial infection in these patients, and hence these antibiotics are being given regularly. And because of that, the resistance level goes very high. Now, this is the point where we have to think very sensibly and look into this crisis, that how to control infection. The simple thing for a general people, that we have to stop using antibiotic if we are not in use until we prescribed by the physician or qualified physicians. We never use antibiotics. Never use antibiotic over the counter. Never stop antibiotic before the prescription time. And give proper comply to the prescribed antibiotics. I think if we follow these things and we try to curtail the infection as much as possible by washing our hands, cleaning the space around us, all hygienic conditions, try to maintain in the living area, in the environment around us. So these things can protect us to some extent to control the infection, and we can control the antibiotic resistance too. I think this message has to be spread across the world, just to make aware people's not to involve in so many usage of drugs, antibiotics, to further put a selection pressure on the antibiotics, these bacteria to develop antibiotic resistance. Thank you so much.